Welcome to Morning After, the show that sheds light on the difficult topic of pregnancy and infant loss. This is a place where you can find solace and community through hearing other people's journey. I'm your host, Jasmine Compton. Welcome back, everybody. It's been a minute, but we are here with one of my very most special guests, my husband, Patrick Compton.
One of your very most special guests.
Yeah, the most special guest. Super excited to have him here. You know, I think in the future, we might bring on partners more just to, they have their experience with miscarriage and infant loss. And sometimes they remember things that we might forget as we tell our stories. Mm-hmm. So want to be able to bring him in and, kind of share his experience, his journey from our last episode, sharing my journey with miscarriage. I said that I would be keeping you guys updated on my next part of my journey.
Yeah.
So,
and if anyone feels curious, is wondering why we're so far away from each other, partly it's because the microphone setup, but also you do need me this far away when we are discussing serious things. If I am too close, it's too much for her neck and her back and all this. So
yeah,
this is a normal distance.
This is the distance that we talk at, because I like to turn and see him. I don't like being super, super close when I'm trying to have a serious conversation. That's a little fun fact about me. So where we left off, obviously shared my journey and my experience with miscarriage and why I ultimately started this podcast. At the end of my miscarriage through that journey, I obviously shared that I got diagnosed with APS, which is antiphospholipid syndrome, essentially a kind of more rare autoimmune blood disorder. It's a blood clotting disorder. There's quite a bit of things that happen within it, just in general, but specific to pregnancy, it can cause a lot of different complications. Recurrent miscarriage is one of them. Increased chances of stillborn birth as you progress in a pregnancy. A lot of other stuff like
increased to compared to someone without it.
Yeah.
It doesn't increase over time, I don't think.
Yeah. I don't know if that's...
We're not exactly sure on that, but yeah.
Anyways, different things, obviously, like blood clots. That's a huge one. Once you deliver, there's an increased chance of having a blood clot in different areas. And then there's other complications like IUGR, which is intrauterine growth restriction. So your baby stops growing in the womb due to nutrient deficiencies, and so lots of different things. There's a whole list of things that it can cause, but a lot of pregnancy complications. The biggest one is typically recurrent miscarriage. Picking up to where I just left off in my story, in the summertime, wrestling with, getting that diagnosis. What does that mean for my life? What does that mean for us trying again?
Right.
We went right into trying again. I think, I've had many interviews now, and, sometimes after a loss, I think people fall in different categories where you either want to break and you need some space, or you're like, me, this is how I was, where I'm like, I was supposed to be pregnant. I want to be pregnant. We went right into trying, and it took us about 4 months, which trying after loss was weird, at least for me. I don't know about you. It felt a lot more pressure filled for me personally, because I was like, I'm already supposed to be pregnant. So for me, there was a lot of like anger and frustration each month of like not being pregnant when I was already supposed to be pregnant.
Well, and at that time you were being told by doctors, maybe you should wait. It would be better so we can maybe get a diagnosis prior to you being pregnant.
Yeah.
And so they're kind of saying, well, maybe it's good that you aren't just now. But at the same time, she was very eager, like she's saying, to just be pregnant since she should have already been.
Yeah.
And so we just had to deal with that over those 3 or 4 months.
That's very true. I saw a hematologist. That's the blood doctor.
The blood doctor.
The blood doctor. During that time to understand a little bit about APS itself, and you have to undergo a test. I got positive. Then you have to wait 12 weeks to get a positive again to actually be positive with it. So
to be diagnosed.
Yeah,
with
to
it.
be fully diagnosed.
You need 2 positive tests 12 weeks apart.
Yes.
Yeah.
And so I feel like that was part of why they were like, maybe it's good that you're not pregnant yet so that we can get this diagnosis. But to our excitement, after like 4 months, we got pregnant. So good news to share here is that we are pregnant, which is super awesome. I'm about 20 weeks, almost 21 weeks, so I'm definitely over halfway. It has been a journey, a very different experience. As people know who've gone through it, pregnancy after loss is very different than before you've experienced loss. And for me, having this other added layer of having this APS on top of it is definitely unknown territory. As soon as you get pregnant, I mean, with APS in pregnancy, you are considered high risk. And so as soon as I found out I was pregnant, which I found out like 4 weeks, right. Essentially called all the doctors, the hematologists, OB, and everything really switches and you go into kind of like treatment mode, essentially. So I went right into the hematologist, the OB, had to see, the MFM, maternal fetal medicine doctors, so the high risk doctors, and immediately went on like the treatment that they do for APS within pregnancy. So
tell them about it.
Yeah, it was wild. So you need to be on blood thinners because it's a blood clotting disorder. So your blood gets sticky and you have to like take anticoagulants, blood thinners to like thin out your blood so that doesn't happen. So essentially I'm on like low dose aspirin, which isn't a big deal. And then you're on this other drug. Typically there's multiple, but I'm on a drug called Lovenox. It's a daily injection into your stomach. So, that was a pretty surreal experience.
Yeah, and it's not like a diabetic like insulin, push in insulin where it just kind of push and it's done. It's a legit needle, not the longest thing ever, but it's a legit needle that you have to stick into your tummy.
Yes,
it's intimidating.
It was very shocking being at the doctor's the first time to have the nurse walk you through it because I thought it was going to be like that where it's like, I'm not saying I wouldn't want to stick myself with an insulin needle every day anyways, but it was not what I thought it was going to be. When she pulled out the needle and it's like an inch long, and she was like, "Oh, you just have to jam it into your stomach,
squeeze your tummy, and then
jam it in." It took me 20 minutes with her. Mm-hmm. I think I started crying. I was having like a panic. But she assured me that like everybody freaks out. It is no one's ever come in and was like, "Oh, okay." It's a weird thing, let me tell you guys, to insert a needle into yourself. It is just not normal. And when you're faced with it, it's wild to think like, even if you are fine with needles, it's not even about that. It just feels unnatural to like put a needle. You put it in and then you have to press, and the medicine comes in after you press it down, and it burns a little bit. I got through it, obviously. I had a moment where I thought for a second, I was like, I don't think I'm going to be able to do this every single day for the entire pregnancy. And then because the chances of blood clots go up after you give birth, you have to continue for like the 6 weeks after at least. And then I'll have a recheck-in with the hematologist to see. So after pregnancy, the future of what that treatment for me is kind of unknown right now and what it'll look like. But yeah, doing it every day. I was like, I don't know how I'm going to do this every day, but I knew that I needed to do it myself because you weren't going to be able to someone wasn't going to be able to do it for me. No. And as us moms always do, because we're badass, we just suck it up and we do it for our babies. So I did do it. I cried, but after a couple days, I did I don't want to say get used to it. I don't think you ever get used to that. I think every morning, it's the same time, and every time I get that the reminder to do it, I am annoyed that I have to do it. Yes. And then the bigger you get, you have less to like pinch onto, and it's, it definitely can hurt. And there's bruising from that also. So my stomach doesn't look cute, like a cute pregnancy tummy. So there's just like bruises all over. But yeah, so I will say there's a lot of unknown. For me, again, I'm about to be 21 weeks. The first trimester was super rough. Again, pregnancy after loss, there's a lot of layers in my experience so far. I think what comes with pregnancy after loss is just so much anxiety that you're going to re-experience what you've already gone through. You are holding your breath every day. You're absolutely holding your breath, and there's different types of miscarriages. So obviously, just a reminder, mine was a miscarriage. So I found out by going to, an ultrasound. So the first ultrasound, which for me was scheduled at 7 weeks, was the amount of anxiety leading up to it. I mean, and every ultrasound since, I have a ton of anxiety the days leading up to it, because you just can't get out of your head that you're like, am I going to see, is the same thing going to happen? Am I not going to hear a heartbeat? So, there's this layer throughout this experience that's just tainted and kind of taken the innocence and sometimes the joy of what it is. And,
especially when ultrasound techs, doctors, they've been great, but it is always a thing where it's like, after 3 or 4 or 5 minutes of them, taking this measurement, that measurement, it's like, so heartbeat, oh yeah, there's, okay.
Yeah.
And it's like, that's never the urgent thing. They're like, automatically, yep, 160 beats per minute.
Yeah.
They never give you that.
That at each one they're chatting, and they're not really, the sonographer's not really allowed to like tell you much unless there's no heartbeat. They obviously can say that, but like, they don't.
You can see it, obviously.
Yeah, but they don't lead with that. To your point, it's always like, great, I don't care about, like, is there a heartbeat first? Like, so I think there's a lot in the first trimester specifically. Like, I had hyperemesis. I was sick with my first, but nowhere near. So for me, I'm going to be talking about the layers of pregnancy after loss.
And again, emesis is vomiting. That's not always on the front of people's heads too.
Yeah.
So,
yep.
Hyperemesis.
Yeah. There you go. We'll get to that. But speaking on, I'll probably share throughout just the anxiety of pregnancy after loss. That's one layer. And then another layer is, what is the APS diagnosis and what does that mean throughout this, and what that adds into my thoughts throughout the pregnancy. And then first and foremost, for the first trimester, the sickness piece. That was the forefront because it was so intense. I mean, I don't know how it was for you as my husband, but I could not have gotten through it without you at all. It was pretty horrible. I definitely was like pretty much bedridden or couch ridden if I made it to the couch for like 2.5 months. I didn't go to the office. I had to get like ADA accommodations to not be able to go. And it wasn't just, it was vomiting. It was, I had such intense aversions. It was like, it's to such an extreme that it was like, I struggled to put food in my system. I couldn't put water in.
No, yeah, you had an aversion to water, basically.
Yeah.
And you had to have some workarounds for that.
And then with all of that, you're pregnant, you're not eating, you're not really drinking, you're vomiting. I mean, the weakness that I had too physically, like I literally couldn't get up at times out of bed. There were days when I really was bedridden. And all of that affects you mentally, all the while you already have anxiety of, oh my God, is my baby okay? Am I going to make it to this next week? And then, obviously any of the added layers of anxiety before an ultrasound.
This is also why females evolved to have higher stores of body fat on them in case issues come around during pregnancy. The babies are going to be okay.
Fun fact, yeah.
Fun
I mean, it's good to know. Yeah, you do freak out when you get sick, and typically they're okay. Though in hyperemesis and extreme cases of hyperemesis,
Yeah.
that's
It's not a guarantee,
right.
but it's something.
Right. Yeah.
There's a reason. There's a reason for it.
For sure.
Yeah.
And in my case too, I don't know if I shared this when I very first shared my story, but I also have Crohn's disease. So there's this another health layer of an autoimmune disease that's like specifically in your GI tract. So there were, when we talk about food aversions and we talk about food, when you're, barely able to eat and there's things that you can mentally even fathom eating, some of the things that I could even fathom eating, I can't actually eat with that disease. And so it became super emotional. I then had to get on Zofran because it was the only way I could kind of function. I mean, that did help me, but it wasn't like world changing. But as I think many people might know, maybe don't, but one of the big side effects of Zofran is constipation. And when you have to take it every day, I was personally really worried about what is that going to do with my GI tract. And after prolonged, I think like 2 weeks of taking it, there was a point that I did end up in the ER because not pregnancy stuff, but how Zofran affected like my GI tract.
I legit forgot about that.
Oh, did you?
Yes.
Yeah, it's ingrained in my mind because it was horrible.
Yeah.
It was, I was throwing up not from pregnancy stuff, but from the pain of my upper abdominal was a level 10. And, I know my body really well because I have so many health issues. So it's like I'm very in tune with my body. I know what is like I'm able to differentiate, like that was not related to like the hyperemesis and the pregnancy stuff. This is something totally different. And, I had to call my GI and they were like, you need to go to the ER with that level of pain. And so we did. And I think I almost went to the ER a couple other times for throwing up. But, it's also really hard when you're like, I'm so sick. Like it was hard to get to the ER because it was like, I can't leave the restroom. How can I even get there?
Well, and then once we get there, it's a bag. It's one bag of IV fluids. Yeah, and that helped.
It did help.
This is also at the time, kind of following all the hurricane action in the southeast, and a lot of that medical supplies.
There was an IV fluid shortage.
Is in the Tampa Bay area, which got hit, and so there was an IV fluids shortage.
Yeah, so that was hard too because people don't want to tell you to go to the ER unless it's absolutely necessary because there was a shortage. Right. So weird times, but I did, I will say the first trimester was probably some of the hardest times in my life. I deal with physical chronic pain every day, again, with having Crohn's. I having this sickness on top of everything, it just was compounded. And I think like the mental toll that it took was like, I mean, there's really not a lot of words. I wanted to give up many, many times. I really struggled with feeling like this is what I prayed for. Mm-hmm. I wanted this baby. This is a rainbow baby. I should be so, so thankful. And feeling extreme guilt. It feels like I could cry right now thinking about it. But I don't want to cry. I don't want to mess up my makeup.
We got tissues over there.
Yeah. I felt extreme guilt for feeling so miserable that like there were days, many days that I just was like, do I even want to be pregnant? Like, I really, is this really what I wanted? Yes, I will need these.
Thank
you. And dealing with that guilt was just so extreme. It was tough for sure. And I definitely felt, I have a great support system and my friends, but I felt super isolated from pretty much everybody. I mean, I wasn't really seeing a lot of people. And again, I wasn't going to work in the office. I was working from home. Thankfully, I have a job that supports me in that. But, and my personality type is super extroverted. So it's like, I need to be around people. It's not good if I'm not around people. But I felt isolated. It felt like I couldn't really articulate how bad it was, because I don't want to downplay the things that women have gone through or go through in pregnancy. A lot of women do experience, nausea and vomiting is common in pregnancy. And it's not like I want to be like, but no, you don't understand. Mine's so much worse. Sure. Like, I didn't want to come off that way, but I was like, no, but like, this is different, you guys. Like, I'm not okay. It was really hard, especially, you know, it's a different experience too. Like I have a toddler, you know, you're more tired and trying to be, you know, I felt guilt of like not being a present partner, and then not being a present parent. I could not parent Isaiah at all. Like you had to take off work sometimes. Our family had to like step up. I had some friends who I did call, but to be honest, I really struggled to like hit up friends. I just didn't want to.
Right.
I didn't want to inconvenience people, and like I had made up this thing in my head, I think too, where I'm like, people just aren't gonna understand, because there's like this part of you that, you know, I think I've talked to some people who have who had extreme hyperemesis, which is people who are hospitalized, people who had to get IVs weekly. It just felt like, again, I don't want to like down, like I wasn't wanting to be like, you guys don't get it, you know, but so I kind of felt like I couldn't reach out a little bit, because I'm like, oh, everybody feels shitty and sick sometimes during pregnancy, but it's tough really,
because it is easy to say, well, yeah, that, I mean, morning sickness is part of pregnancy. So it's easy to be like, either to yourself, or you think other people will be like, well, that's just normal, right? Kind of just like deal.
Yeah, and that's, I don't think everybody really meant that toward me. I think I kind of made that, but it would feel at times a little bit like I just couldn't really articulate, like, no, you guys, like, this isn't just like, this is where hyperemesis can also be different too. And this is a differentiator, not just how many times you throw up or vomit, but it's like nausea is common, right? But nausea literally to the point, like all these things to such extremes where like you can't get up out of bed. You can't, like, this is going to be maybe TMI a little bit, but like, it was so bad. Like I couldn't, like I barely brushed my teeth. Like to get up and shower
I didn't know that.
No, he knew that. I barely brushed my teeth. I barely could take care of
This is news to me.
I could barely take care of myself. I mean, there were times when you had to like help me like get up to like, you need to shower. Like it really, and this is like this cyclical thing too. It triggers, and it can trigger like depression. I was extremely depressed too.
And isn't normal morning sickness something like, what was it back in college and like the partying days where you like puke and rally type of thing?
Yeah, I mean,
isn't normal morning sickness more often associated with like, yeah, you feel it, and then after you vomit, you'll feel better? Whereas hyperemesis, it's not that
I think
case.
There can be. I think there's people that have like had nausea throughout the day. Okay. You don't necessarily. There is that. I never felt that. That is a thing, a part of it. Talking to my doctors, it's like there was never like, oh, I'm gonna just throw up and I'm gonna feel better. That did not happen. It just continued. Yeah. But I do think there's women that have you have nausea throughout the day. But there's some differences. It's kind of. Some of it can be hard to differentiate. Like, that's where I'm like, I don't want to downplay other people's experience and stuff like that. It's just, that's where I was like, but you guys, this is like, I can't like get up. Like, and again, I already have autoimmune, and then I have this new autoimmune disease with these new drugs I'm on. And I am on a drug for Crohn's that also is a very heavy drug as well. Everybody knows and talks about. Which
compromises your immunity.
Right. When you're pregnant, your immune system's compromised too. But I have an
immunosuppressant.
Yes. But I, with Crohn's, am on an immunosuppressant. I think that's like administered like an IV every 8 weeks. So like it's kind of like they're just all the health issues. There's like this exacerbated process. So and then, at 7 weeks, we have our ultrasound, the first one, there's a strong heartbeat. We get through each milestone. We treat it like we celebrate. And then as soon as it's done, it's hard to not like also still be paranoid in the back of your mind. Like, oh my gosh, I made it 1 week, but what am I going to make it the next week? Especially you kind of, I think, compare your journeys to your previous journey. So I was like, am I going to make it past where I was? Right. From 7 weeks to 8 weeks, something happened where I started having bleeding. Forgot about this. Did you forget about this?
Of course, I forgot about this.
And this was literally the day after I had the 7-week ultrasound. So I'm paranoid. It starts, and it was got to be detailed here, but it wasn't blood, like blood red or even light red. It was brown. Yeah. But there was almost every time I wiped. So I let the doctors know, but it started to like kind of increase. And there was then a day after they got me scheduled for an 8-week ultrasound. So a week after the
Well,
7
already
week.
they were like, okay, we're happy it's not the bright red though.
Right. So that's kind of where it was like but every day, every minute of the day, I am going to the bathroom, I'm checking, I'm paranoid, is it going to change? Because yeah, you don't want it to change to bright red. However, I was paranoid because part of a miscarriage, some of the symptoms is like you could have the brown as most people know, but let me just say that is just old blood. Sure. So it's still like, you don't want it to go to the bright red. So every single day throughout the day, I was anxious. Anytime I felt like, oh my God, is something coming out, I would run to the bathroom whether I had to go or not. So it was for a whole week, high anxiety. Like, is that what's going to happen here? And I'm 8 weeks is how far I made it before. So it was like, we're coming up on that time. So we get the ultrasound and, the heartbeat looks great. I get some relief. I start to feel better. And then I look in the notes and see in the notes that they saw what's called a chorionic bump. You look up a chorionic bump, and it's like similar. It's like a hematoma. So probably what was causing the bleeding, but it was commonly associated with causing miscarriage. And there's subchorionic hematomas. There's then chorionic bump. That I think the difference is like the location of a chorionic bump was like close to where the placenta and like where I can't remember specifically, but then I talked to the doctors and they were like, it's a 90% chance that everything's going to be fine and that it goes away on its own, but we just won't know. Mm-hmm. So then we add this other layer and I still kept bleeding. I did ask for prayers and got on praying. And for me, prayer is important. I believe in the power of prayer. And honestly, after that, it had been like 2 weeks, I think, by that point of bleeding. I prayed. I had a lot of people praying. And it was like a couple days after that, and it went away. And then the next ultrasound, which I think was 2 weeks after that, by the 10 week, it was completely gone, which was so awesome. So you're looking at me.
Well,
do
just
you remember?
all of this has been on my mind for a while during this podcast, where it's like we've talked about this, but all of this that you're explaining, plus all the stories you've already, heard from different women. You work at a German company and you've heard of people you work with or online of Germans are like, what are these American women doing? They are warriors, they are beasts, like all the stuff they have to go through. And it's absurd to me that we don't have some policies in place where a woman after her first trimester or whatever it is, it could be more personalized, doesn't have to worry about work and paying the bills. Yeah. And can be taken care of during the pregnancy and for, a year afterwards, especially in a country with one party that is all about family values and the other side that's all about, individual rights and civil rights and this and that. You'd think both would be able to agree on this thing. And yet here we are. And women are just left out on their own. Thank God you do have the support system you do. Yeah. What about for the 16-year-old, the 19-year-old, the 28-year-old who is, much more isolated?
Yeah, I mean, and the company I work for too is, I do have the ability to work from home. I am supported, but that's, you bring up another layer of this whole entire thing is that if you're a working mom too, like I'm still working through this. I am able to work from home, but I'm still having to deal with the stresses of work. And I felt very supported by, my team, the people in my role that I support were super understanding. But yeah, I mean, I was not at 100% capacity as a person, as an employee in any way. And it was super hard to come, show up in a way each day while I have through all this anxiety every day and the sickness, all those things. I mean, yeah, it's a whole other layer. Mm-hmm. But I did make it through the first trimester, and the positive to being high risk is there's a lot of monitoring. There's a lot more ultrasounds. There's a lot more appointments, which though there's a lot of anxiety leading up to appointments, it also is it's like reassurance each time to be able to see baby way more than if I wasn't high risk. So
You're getting the best care
for sure.
Anyone basically could in this country.
For sure.
Because of the high risk nature.
For sure.
Yeah.
But Patrick here is going to have to go to work here shortly. So I do want to get, some of your thoughts before you hop off here. Obviously I'm going to continue sharing about anxiety throughout the journey now that I'm over halfway, certain things that come up within APS in the future. But like for you as my partner, as someone also who experienced the loss with me,
yeah.
How has it been, I guess, for you seeing me and just your own experiences within this pregnancy?
It's definitely
post-loss. Yeah. What is it?
Well, I mean, post-loss, it's a big thing, as you know.
Answer it in 2 minutes.
Yeah. The loss completely changed my perspective on a lot of things in some significant ways. Guys can relate with you have to be the strong one to support the woman, but also you're at the same time feeling what you're feeling. The loss completely changed my perspective on a lot of things, on life, on human rights, and the most impactful thing for me, as I've shared with you before, was we had so much support, which is great. So many people giving of their time and their resources, and it's beautiful. I've been super thankful. I do see it as a huge gift, as a blessing. And so when you do, this just happened last night, when you are feeling stressed and anxious and worrisome, it's not like me trying to pretend, I got to be the strong man. It literally just is my perspective now, where it's my first thought. It's like the babies are in God's hands. We all are, but especially so the most vulnerable, and so worrying about this, that, or the other, literally, as I'll just share it for everybody, it cannot change the situation. We are just doing, and this applies to all sorts of,
life.
Wherever you are at in life, but it obviously pertains to you going through your pregnancy. You're just doing what you need to do. You're eating, you're drinking, you're getting your rest, you're doing what you can as you can. And that's all you can do. And then we have to just leave it up to God and trust, trust in His providence. So that's where my head and heart's been at.
Yeah, it's a great reminder. It's definitely hard, and I think it's it's good to hear your experience. You got to have the partner who is. It is a different experience. Like this is, it's hard to get out of your head. Doing this podcast has been a blessing, but I'm not gonna lie, it's difficult to do these interviews, and I think as women we all hear stories, and so the stories are in your head in general. And then when you've lived out having a loss, what I think I've probably said this in previous interviews is you have experienced the thing that women have anxiety over. Your worst nightmare came true. So then because of that, it makes everything a possibility. And so, again, all of us hear stories. I would say doing this podcast has been amazing. I feel like I've connected with so many women still that I speak to throughout this experience to go to for advice, and a listening ear of encouragement too. But it is difficult because it is I've heard some of the worst stories, and it's hard not to throughout the journey too, just think oh my God, is that going to happen to me? And then for me with APS, like we've said, there's these things, these complications that it can cause. So he's referencing, again, I'm 20 weeks, almost 21 weeks on Monday. So we had our anatomy scan, which was awesome. It went really well. She looks good. I'm having a girl, which is amazing. But she looked really good. She's looked good each time I've had ultrasounds. But where the anxiety comes in is she's measuring a little behind. She's measuring a little petite. And one of the things that I had with Isaiah is called IUGR, intrauterine growth restriction. That's where they stop growing in the uterus. But that didn't happen with him until third trimester.
Yeah, way late.
Yeah, and so that is also more that's a pregnancy complication from APS as well. And just with any complication, there's a mild, it's on a spectrum, right? And so, I've seen and heard stories of that. People I've interviewed here have had similar things that have had not great outcomes. And so it's always good, though, to be reminded of, the reality is you can only do what you can do. You can control the controllables. Yeah. And, I'm doing treatment. I'm doing what I can. Yeah. It is in God's hands ultimately. That's all I can do. Yeah. So, well, anyhow, Patrick has to go to work, and I'll finish this out. He does, but thank you, babe. We love you for coming on and sharing a little bit of your perspective. It was great to have my husband on here to help give his perspective and also remind me of things maybe I forgot. But yeah, overall, I have made it over halfway. For me, I have to have a C-section, so I'll be delivering scheduled C-section at 37 weeks. 37 weeks is the, I guess, the recommended time for people with APS for mom and baby to thrive more, I guess, and be the most safest time to deliver. So I think I have like 17, almost 16 weeks. Who's counting? But as I look to the future, to kind of round out on the anxieties and the feelings throughout, the pregnancy after loss piece, as I kind of have said throughout, there's definitely, there's an increased chance of stillborn birth in APS. So there's still, I think, just anxiety hurdles to get through in the rest of this time. And it's hard. It gets hard not to hyper focus. But like Patrick said, when you do all you can do, that's all you can do. It's in God's hands. So I will definitely be keeping everybody posted along the way. I'll probably provide another update maybe closer to delivery. But excited to have you guys here with me on my journey. And thank you for listening. And my last plug is like and subscribe and share. And if you know anybody who's experienced pregnancy loss and or infant loss and wants to come on and share their story, would love to have them on. Thanks, guys.